Hey there, I'm Sarah Zarella, a portrait and wedding photographer and your host for Wedding Secrets Unveiled. This is a podcast where we cut through the complexity of wedding planning, leaving you with everything you need to know directly from the industry experts. If you want to simplify your wedding planning while having fun, of course, you came to the right place. Join me while I guide you through your planning, starting from your engagement to your big day where you say, I do. After photographing for the past 19 years, I am sharing with you tips and tricks to cut through the excess noise because I believe from the moment you said yes, your planning experience should be a magical time in your life. Here you will find episodes that are fun, stress-free, and straight to the point with a fresh, honest take on the reality of what you really need to know about planning your perfect day. Let's dive in. Welcome back to Wedding Secrets Unveiled podcast, friends. Today I have a little treat for you. I am joined again with Dr. Simpson. She is the owner of SeaMist MedSpa. We had her on a few months ago when we were talking about treatments, options for you all that are getting married or prepping for a wedding or event. Today, we're actually going to kind of get into a little bit more about prep for men. We focused on the women last time. We're going to focus on the men this time. So if you want to know a little bit about injections, Botox, laser hair removal, B2 injections, cool sculpting, you name it, we're here to talk about it. So sit back and relax and enjoy my conversation with Dr. Mary Christina Simpson. Well, welcome back.
Thank you for having me back.
I am so excited to have you on again. I know that last time when we had you on, we kind of teased around the fact that we need to have you on again because we need to talk about the men in our life.
Yes.
But now here we are.
We're back. And it's true. We can't forget those grooms that you always tend to put on the back burner because the brides tend to take center stage in this wedding thing.
Or the father of the bride.
Correct. Or the groomsmen.
Yes.
Or the brother of the bride.
Or the brother.
Or anyone else that identifies as such.
So with that said, before we get going, can you tell our listeners a little bit about who you are, who you serve, and what you do in your business?
Absolutely. My name is Dr. Mary Christina Simpson, and I am the owner and medical director of SeaMist MedSpa. We have a location in South Kingston, Rhode Island, and in Newport. We serve all genders, all ages, starting in your teenage years, going all the way through your 90s, providing medical services and wellness services to the population of Rhode Island, Mass, Connecticut, and whomever else wants to join us.
And how long have you been practicing for?
So I've been in medicine for over 20 years, but I've been doing aesthetics specifically for the last 5 years.
Wow. Well, with that said, Dr. Simpson, let's just get right into it,
Okay.
right? So I've been hearing this terminology, Botox. Tell me a little bit about what this is.
So it's just a silly pun on words, but Botox is just Botox for men. And we say Botox like we say a generic phrase like Tupperware or Kleenex. People tend to know a neurotoxin or wrinkle relaxer as Botox, but there are a couple of them out there like Xeomin, Dysport, Jeuveau, Botox, and Dexfy actually just came to the market now, which is a longer-term muscle relaxer.
And how would you know which one to use then, if you're a consumer?
So you have to leave that up to an educated provider. You know, some people have a preference. A lot of people have no preference. Some people have a timeline where they say, I have an event in 3 days. You want to give them something that is faster acting. If someone wants to be a little more frozen, you want to choose a different toxin. If it's someone's first time, we usually leave it up to the provider. A neurotoxin like Xeomin has no purified protein. So long term, people aren't going to get an antibody response from it.
So if you are a listener right now and you have, obviously yourself, you can always take these tips, but if you have a man in your life that you feel like could benefit from these services, that they have a big day that they have coming up that they want to plan, when should they start treatment?
So you really have to decide what your what your biggest problem area is. So when you go into a provider, you can say, okay, I love this about myself, but I'd really like to improve this. And if it's a face issue or a body issue, things take different times. So if we're talking about Botox specifically, okay, we want to plan at least a month ahead of time because it's going to take about 7 to 10 days for the Botox to kick in. And then if we do have to make any adjustments, we're going to do that at about the 2-week mark. So again, giving yourself a month preemptively, it's going to be great. Also, these neurotoxins last for about 3 to 4 months. So I ideally tell people, test it out way before your event, meaning 3 to 6 months before, because if you love it, it's going to be there for 3 to 4 months. If you don't like it, it's going to be there for 3 to 4 months. It's not something that's reversible, so you really have to plan ahead.
What are you seeing that people are trying to correct with it?
So a lot of men and women, but we'll talk about men, want to correct the line that's in the center of their eyebrows. So the single line, the 11s, the 3 lines, they want to correct the lines that go across their forehead, the crow's feet. Those are all areas that, young men start to see as they're out in the sun and they're squinting, we have a lot of big fishermen population here in Rhode Island, and so the people on the water and kind of get those harsh weather conditions tend to really use their facial muscles a lot, causing those static lines, and they want to correct those.
That's so funny because you're right. It's like being a photographer, I guess I could sit there and I say I do cosmetic surgery with a click of a mouse. I mean, obviously it's a little bit more in depth than a click of my mouse, but, that is the problem areas that people want me to do. They want me to lighten up their, I guess for lack of better terms, crow's feet.
Crow's feet, yes.
And then the lines in their forehead, they're number 11s. So it's just so funny. So you can get right ahead of it and do it instead of just in a photograph. You can actually do it in person.
We can. And, another area that men like to treat is the area under their eyes called the tear trough. So a lot of men have dark circles, whether it's genetic, allergy-driven, or they're just aging, normally, and they lose fat in those areas, in the cheek, in the, in the eye, and they do want to replace volume.
So what do you do with that?
So one of the quickest ways to replace volume there is to use a derma filler, which is usually a hyaluronic acid filler, which is injected in and absorbs the water content of the tissue. So it lasts, between 6 to 18 months, depending on what filler you choose, and it does help raise the tissue so the discoloration is not as severe. And the hollowness, I should say.
So I guess that leads me into my next question, is fillers. So you're finding that men are doing them underneath their eyes. Is there any other spots typically that you're seeing that men are using?
Absolutely. So we're seeing them under the eyes, in the cheeks, in the jawline is a huge place. Some men do their lips. We treat men very similar to we treat women. We just treat them per the features that they, are looking for. And for a male jaw, a lot of men want to be more masculine. So want a more square jaw, a more square chin. They would like the volume in their cheeks to be a little bit more because they don't like the nasolabial folds, the folds that are on the sides of the mouth from the nose to the mouth. They feel like they just look old. Yes. And so they want to just look refreshed. And so adding some youthful volume in the form of we can replace fat, but non-surgically. This is a really easy, quick way to do it.
What are some other tools that you guys are using to help stop the aging process with the men?
Absolutely. So skincare is huge. So doing things like a hydrofacial or a chemical peel to really help exfoliate off the top layers to cleanse the skin. Glowing skin in men is as youthful as it is in women. And men tend to shave, so they tend to exfoliate their face daily, whereas women dermaplane maybe monthly or maybe never at all, but they're not tending to normally shave their face. So men tend to age a little more gradually because they actually are exfoliating off those top layers.
That's so interesting. Yes. I didn't even think about that.
Yes. So that's why, we have things like dermaplaning, which is removing the layers of fine hair that we do for women with a scalpel, but men actually take a razor. We also do a lot of laser hair removal for areas of the face that guys don't want to shave. They don't want to shave their upper cheeks. They don't want to shave their back of their necks. they don't want to shave, underneath their chin necessarily all the time if they're getting kind of chronic ingrown. So doing a series of laser hair removal before a big event, takes there's 6-week treatments, and there's probably 6 of them, so you really have to plan ahead for that. But that's a really great way to have hair reduction there.
So for the laser hair removal, you're saying it's usually about 6 treatments, and you think about 4 weeks apart, or how?
4 to 6 weeks apart, depending on the area. But you definitely want to. You need to do it when you don't have a ton of pigment in your skin. So during the summer is not the best time. So kind of starting right now, actually fall time is the best time to start, and then going throughout the whole winter into early spring before you have that sun exposure.
Got it. So if you're planning, attending a wedding or getting married, you got to think at least 6 months in advance, but also 2 time of year.
Absolutely, and how pigmented your skin is, because certain lasers, treat darker pigments differently than lighter pigments.
Now, what are you doing with laser hair removal for men? I mean, I'm sure there's a whole wide range, but what are you typically seeing for people who are listening for ideas that you're helping treat?
So the most popular areas that we're treating is the upper cheek, where the beard tends to grow above the beard line, the upper cheek, under the chin, and the neck, the back of the neck. The back is a huge area for men. We do other areas as well, just like we do with women. But most men, typically treat either, very hairy backs or super hairy chests, or things like that they want reduction, but not necessarily complete hair, removal.
And getting back to the hydrofacials, what exactly is that doing? Like, is it? Obviously, you said it's brightening, but what else is it doing?
So it's cleansing the pores. It's exfoliating the top layers of the skin. And by doing that, you're brightening the top layers. It's cleansing all the areas, and then we infuse actual serums back into those open pores when they're there. So depending on what kind of solutions we use, we can do some anti-aging or some hydrating or acne control, different things to treat whatever condition the skin, is going under.
And how often do you recommend that you get that done?
So ideally you can do it every 4 to 6 weeks, but I think more typically people are doing it seasonally, so they're doing 4 a year. But doing a series of them is really effective because you can treat, if you have cyclical acne or anything like that, you can treat that monthly, and so you're really kind of targeting the product that you have.
I mean, this might be a silly question, but when you look at somebody that has that natural glow, and I'm just going to bring up like J-Lo, for example. I mean, what is happening over there? I mean, obviously, that cannot just be genetics, because I've seen her years prior, and she doesn't have that natural glow. So what's going on with that?
So, we really don't know, because she says it's all due to olive oil and her skincare line. But, in the, medical aesthetics industry, we do have some thoughts that it probably is a little bit more than that. Most women in Hollywood are doing some kind of chemical peels, some kind of Botox or neurotoxin.
On a regular basis.
Correct.
Yes.
Fillers, lasers. They're using retinol skin products, which helps the cellular turnover. So it's a combination of really good skincare, a lot of treatments.
Right.
And regular treatments, not once a year, not random. It's basically adding, additive treatments.
Layers and layers. I mean, so we're seeing a product of what you're talking about over and over again, because obviously they had the financials back to do this.
Right. And it's also, you need to treat with multiple things. You can't just treat with one thing and expect that outcome. Right. But glowy skin is equated to youthful skin. So to have that glow is great.
Well, that's amazing. So what we did is we just kind of went over a lot of facial treatments, but I say let's take a break, and when we get back from a break, we can go over body treatments.
Sounds great.
Perfect. I appreciate you being here. And hey, if you like what you're hearing, I encourage you to check out our website at sarahzarella.com. And don't forget, you can actually subscribe to this podcast wherever you're listening so you never miss an episode. And I would so appreciate if you left a fabulous review on Apple Podcast. Even better, share it with a friend. It's a great way to show your support. And now, let's get back to the episode. All right, well, welcome back to Wedding Secrets Unveiled podcast, friends. So before the break, we were talking about how to get your face picture perfect for your big day coming up. But with that said, let's talk a little bit about what you can do for the body.
Absolutely. So when we talk about men specifically in this podcast, we look at different treatments that our male clientele are more targeted to. So one is hair loss. So a lot of guys come in and their hair's thinning, or it's, they're not at a point, whether it's the groom or the father of the bride or the brother, where they're really comfortable taking pictures because they see this hair loss progressing. So PRP injections, which is platelet-rich plasma injections, from your own blood, spun down, and then injected back into the scalp, helps really, really stimulate the hair follicle. That's in combination with some other medications like minoxidil, which is Rogaine, like finasteride, which is Propecia, with different vitamins like biotin, can help stimulate hair growth and prevent future hair loss. So I tell all my male clients it's not going to make you like Eddie Munster, but it's going to help slow down the process. And so, we find a lot of younger guys doing this, especially preventatively. They see what's happened with their fathers, their grandfathers, and the genetics of it scares them.
Right. So when do they need to start something like this?
So that is a good at least 4 to 6 months before your wedding, because it's going to be a monthly treatment for about 4 months in a row, and you're not really going to see the hair growth for 2 to 6 months.
And is this something that you have to pay attention to seasonal or no?
No. So, see, it's not seasonally affected. Men can do this all year round, but you do have to plan a good 4 to 6 months ahead of time, because you're not going to see the hair growth for a good 2 to 4 months into the process. And you really do want to make sure, like I said, this is the route you want to go before you start doing these treatments.
So what are some other things that men can do to prep for their big day?
So a lot of men come in and they're worried about their abs. They're worried about their flakes.
Yes.
They're worried about different areas that they want to treat because they are working out, and, they somehow the year plan of getting ready for the wedding, they want to do whatever they can do to kind of maximize their gym routine. So we recommend things like M-Sculpt Neo, and Cool Sculpting. Those are different machines that treat fat and muscle, and some just treat fat. So M-Sculpt and M-Sculpt Neo treat muscle. Okay, it's a stimulation device that kind of is the equivalent of 20,000 sit-ups in 30 minutes.
Wow.
Yeah. So, and the Neo actually helps burn about 30% of fat with each treatment cycle. That is a week apart for 6 weeks. Okay, so you really want to plan that like 3 to 4 months ahead of time. Okay, so that you can have your optimal results for your wedding, for your honeymoon, for any of those times that you're going to really, see body pictures or whatever. The other thing is Cool Sculpting to get rid of the stubborn fat in areas like the flanks. Is a huge area that men like to treat, lower abs. Those you really have to plan a good 15, to 16 weeks before the wedding, because you'll then do your usual second treatment about 12 weeks before. It's going to take about 3 months to see those results.
And how long do they last for?
Permanent. So
Fat
loss is permanent, about 25% fat reduction with each cycle, but that's permanent. The M-Sculpt is going to last a good, 6 months, but you do need maintenance for that. So like any muscle you stimulate, if you let it go, it's going to kind of go back to atrophying. So you need to, just like the gym, you can't stop going to the gym and expect to continue seeing results. The M-Sculpt is that process. But Cool Sculpting, you usually do it in that area once, twice, and then you're done with that area, unless you gain a ton of weight.
And then what is the cliff notes of the M-Sculpt? Is M-Sculpt versus the Cool? What's the difference again?
So M-Sculpt and M-Sculpt Neo are both muscle toning devices.
Okay.
They use a magnet to, basically it's like a really, really strong magnet that helps those abs vibrate, and the muscle groups like the butt, the thighs, the arms. We can treat all of those areas. That stimulates the muscle in those areas and, subsequently burn some of the fat in those areas. With Cool Sculpting, it's actually decreasing fat by using cold temperatures. Cryolipolysis is the fancy term for fat reduction with Cool Sculpting. Another thing would be to do B12 injection. So that helps with energy, metabolism, to, boost your system. So these are basically larger doses of B12 than you would get in your food or that you would get taking it, under your tongue. And they kind of help boost the metabolism with weight loss and things like that. Again, it's more supercharging your system. It's not something that everyone necessarily needs.
Does it, if I remember correctly, because I've heard about this, it does help promote better sleep, better metabolism. Does it bring up your energy a little bit?
It does. And again, it's very different. So if you have a true B12 deficiency, it's going to really affect you more than someone who has a normal to high level. So someone who has a normal to high level, we probably wouldn't do that. But we do have a lot of vegetarians, vegans, people that are not consuming a lot of B12 in their diet. So these people tend to be a little bit low. So this does help supercharge them. But talking about energy, we treat a lot of second-time grooms where they're getting married again or they're getting married later in life, or fathers of the bride. And a lot of these men come in and they have decreased energy and they have, they feel tired and they can't keep up with their counterparts or even their wife. And so we do a lot of hormone replacement for men with testosterone replacement. So, we talk to them about what their symptoms are and are they feeling a little bit more lethargic or they're not able to keep up like they used to. We test their levels, and a lot of times we can actually give them testosterone to help them with energy, with weight loss, with feeling less fatigued.
Interesting. So you kind of treat the inner with the outer.
Absolutely.
I love
Absolutely.
It. So fun. There's so many things that you could think about with the men in your life, right?
Absolutely. And again, though, you can't forget, those girls that are in your wedding too, or even, groomsmen or bridesmaids. Like a good idea for, an event to have as a group, before the wedding, after a bachelorette party, after a bachelor party. We can do big IV parties where everybody is getting a hydration IV or a hangover relief IV after these parties. We can do facial parties where everyone's getting a hydrofacial, and again, I'm not discriminating men, women, anybody can do it, and basically doing it as a group activity is a really nice way to hang out and treat yourself with some self-care.
It's interesting that you brought that up because we're seeing a couple of our weddings that we did this past year, particularly the men, because I don't think the women had the time on the morning of their wedding, right? But the men were doing the IV treatments. Mm-hmm. We would show up in their room and for what we call groom prep photos of pictures of them getting ready, and they were actually doing the IV treatments that day from the night before.
Absolutely. We do them the night. We do them the day of. We do them the day after. We do them for a lot of different events, and it just kind of gives you that little boost of hydration, that is immediate.
I love it.
It is. It's great.
Well, with that said, for our wrap-up question, what are some key points that couples should be asking their provider when they are inquiring to make sure that they are working with a professional company to ensure that their wedding day is going to be an absolutely perfect event?
So they should always make sure that they are working with a trained medical professional, when having medical treatments done. Number one, they should also go in before for a consultation, well before they want these treatments, not 2 days before their wedding.
Good point.
To find out what they really want to know financially, what it's going to cost, and how far apart the treatments need to be, because a lot of these treatments need series of treatments. So it's great. We love it when people come in a year before their wedding as a couple or individually, and they say, this is really what we want to improve. Our wedding is in 1 year, and then we make a timeline and a treatment plan for them so that they have the idea, the cost, and they know exactly what's planned out for them, so they don't have to worry at all.
You are just a wealth of knowledge.
Thank you.
And I appreciate you coming back your second time.
Thank you.
And for our listeners, they can catch up on your first episode that was launched just a couple months ago. But with that said, I just want to thank you so much for joining me on this week's episode of Wedding Secrets Unveiled. You helped our listeners become one step closer to their stress-free wedding planning process. Can you tell everybody where they could find you?
Absolutely. So you can find us on our website, www.SeaMistMedSpa.com, or our Instagram, SeaMist MedSpa _. We are in South Kingston or in Newport, and our main office phone number is 401-782-2400.
And what I will do for all our listeners is we will have all of SeaMist MedSpa's information on our episode show notes, which you can find on our blog and our website page, which is sarahzarella.com/podcast. Well, thank you again.
Thank you.
Thank you for listening to Wedding Secrets Unveiled. I appreciate you being here. And hey, if you enjoyed this episode, I want to tell you something. I encourage you to check out our website at sarahzarella.com. We love photographing while having fun, of course. Check out our podcast page on our website for our show notes along with upcoming episodes with your local wedding experts. Listen in as we help you plan your epic event. And don't forget that you can actually subscribe to this podcast wherever you are listening so you never miss an episode. I would so appreciate if you left a review for us on Apple Podcasts. Even better, share it with a friend. It's a great way to show your support and let us know what you think. If you know any wedding experts that would like to be a guest, we have a link directly on our website where they can let us know. Thank you for listening.